Strong support for antipsychotic medication comes from research comparing relapse rates between people who continue their medication and those switched to a placebo. A large meta-analysis by Lucht and colleagues examined studies spanning many decades and involving thousands of patients. When medication was replaced with a placebo, around 2/3 of patients relapsed within a year. In comparison, little more than a quarter of those who stayed on their antipsychotic experienced relapse. This provides clear evidence that antipsychotics are more effective than placebo in preventing symptom return, although the benefits must be balanced against potential side effects. Extrapyramidal side effects. Typical antipsychotics can cause serious movement-related problems. These effects occur because the drugs interfere with dopamine pathways involved in motor control. Many patients develop symptoms that resemble Parkinson's disease, such as tremors or stiffness. When medication is taken long-term, some individuals also develop tardive dyskinesia, characterized by uncontrollable movements of the mouth, tongue, and face. These effects can be so unpleasant that patients may stop their medication or require additional drugs to manage the symptoms. Ethical concerns. The severity of some side effects raises ethical issues. There have been legal cases arguing that exposing patients to these risks may breach basic human rights, especially when patients are not fully informed or feel pressured into treatment. Considering adverse effects, deaths, and the emotional burden of these drugs, some argue that the overall cost-benefit balance for typical antipsychotics may be unfavorable. Advantages of atypical antipsychotics. Atypical antipsychotics were developed partly to address the limitations of earlier drugs. One key advantage is that they tend to produce fewer extrapyramidal side effects. Newer medications such as olanzapine and quetiapine are especially less likely to cause movement disorders. This makes it more likely that patients continue their treatment, which increases the likelihood of symptom improvement. Are atypical antipsychotics superior? Although atypical antipsychotics were initially presented as a major improvement, research does not fully support this claim. Crossley and colleagues reviewed studies comparing atypical and typical drugs in early treatment. They found no significant differences in how effectively the drugs reduce symptoms. The main difference was in side effect patterns. Atypicals were associated with greater weight gain, while typical drugs were linked with more movement problems. Overall, both types appeared similarly effective, but each carried different risks. Motivational issues. Some psychologists argue that relying solely on medication can have negative psychological consequences. When patients are told their problems are strictly biological, it may reinforce the belief that they are ill and have little control over their situation. According to Ross and Reed, this can reduce motivation to explore possible life stressors or social difficulties that might be contributing to their symptoms. They argue that because many sources of distress come from interpersonal or environmental factors, supportive or psychological interventions may offer more long-term benefit than simply focusing on medication.